Prostate cancer is considered to be one of the most dangerous types of cancer that men can get, according to the American Cancer Society. Only skin cancer affects men more frequently than prostate cancer, and 1 in 9 men will be diagnosed with a malignancy at some point in their lives. It is estimated that approximately 300,000 men in the United States will receive a diagnosis of prostate cancer for the first time in 2024, and that the disease will take the lives of over 35,000 men. However, if prostate cancer is detected and treated early, its chances of becoming fatal are reduced. According to the American Cancer Society, there are 2 types of prostate cancer: those that progress quickly and those that progress rather slowly. Some men may have prostate cancer that goes undiagnosed for decades without showing any signs or causing any problems. However, the risks connected to prostate cancer are really high, particularly if the illness has progressed to other body areas. Self-diagnosis is possible for certain prostate cancer symptoms. Having said that, men ought to get routine prostate exams from medical professionals. Before we continue, don't forget to subscribe and like this post, which lists the top 10 warning indicators of prostate cancer. Now let's move on to number 10. Scorching or agonizing urinating urine flow is disturbed by the prostate cancer-related gland enlargement. The source of painful micturition is restriction of the urine flow. It is also possible that the cancer has migrated to nearby structures, causing excruciating urination. One of the characteristics that sets prostate cancer apart is its local invasion of adjacent tissues, including the rectum and bladder. Burning during urinating could be the result of an isolated infection or after effects from prostate cancer treatment. Urinary obstruction and retention are caused by the gland's enlargement. Urination may burn when urinating due to an infection of the bladder and urethra brought on by prolonged urine retention. Antibiotics might help for a while, but in order to stop further risks and issues, the doctor has to start treating prostate cancer. The best way to reduce your risk of prostate cancer that goes undiagnosed is to speak with your doctor. Genetics and family history are the main risk factors for prostate cancer. However, dietary and lifestyle modifications may increase the severity of these warning signs since fat exacerbates painful attrition. Number 9. Frequent nighttime urine and nocturia. When prostate cancer is suspected, frequent urine and nighttime pee are dangerous warning indicators. A patient's health may deteriorate as a result of many trips to the bathroom during the night, a disease known as nocturia, which causes a person to wake up frequently to urinate. If the frequency of your nighttime awakenings to relieve your bladder bothers you, you should consult a doctor right once. Nocturia might cause fatigue in the morning. One important tool for determining the extent of a urinary or fluid problem is a bladder diary. Precise monitoring of the patient's 24-hour urine production is required for diaries. Number 8. Urine with blood hematuria is the term for the presence of blood in the urine. It can only be found in the most severe and advanced phases of prostate cancer. There are 2 different types of hematuria associated with prostate cancer. Red blood cells in the urine is a sign of manifest microscopic hematuria that you can only see with a microscope when a patient has macroscopic hematuria. Red blood cells can be seen in their urine with the unaided eye. Urine that is pink or crimson in hue can be seen in 3 to 5% of men with prostate cancer who have blood in their urine. This has to do with the prostate. The most common sites of infection are the kidneys, ureters, and bladder when cancer spreads to other parts of the urinary system. Accurate diagnosis depends on routine urine examinations. To determine the cause of hematuria, tests such as urine cytology, urine culture, ultrasound, genital examination, and rectal examination are frequently ordered. Number 7. Discomfort in your legs, hips, or back. Prostate cancer has the potential to produce severe discomfort in the thighs, hips, and lower back. This is because the disease has metastasized to the bones in these areas. Men with back pain had a 50% higher chance of being diagnosed with prostate cancer than men without back pain, demonstrating a clear correlation between back pain and the disease. Men with advanced prostate cancer also frequently experience limb weakness and numbness. New bone cells are affected by bone metastasis from prostate cancer. A study was conducted on male patients with back, neck, and pelvic discomfort. You need to consult a doctor if you believe that your lower back, pelvis, or thighs are uncomfortable for an unidentified reason. Number 6. Sudden loss of weight. Loss of weight is linked to all cancers, including prostate cancer. Appetite decline, vomiting, and nausea are the most common causes of weight loss. It is still up for debate what the scientific reason for these symptoms is. Doctors advise consuming a high caloric intake to prevent extreme weight loss. Patients with prostate cancer may also notice a change in the flavor of certain foods in addition to appetite loss. If you are experiencing unexplained weight loss, you should see a doctor right away to find out why. Similarly, nausea and vomiting can be controlled with the right drug. Ignoring these signals could raise the likelihood of issues. Number 5. Rectal pain due to tumor invasion of the rectum. Rectal pain may result from prostate cancer that has migrated to the rectal region. Constipation, flatulence, urgency, and incontinence in the stools, subtotal bowel obstruction, diarrhea, and other bowel irregularities may occur. In order to treat these symptoms and determine their exact cause, you must consult your doctor right once. PSA screening and digital rectal examination ultrasonography may help the physician identify the right ailment. Philosophy. Number 4. An uncomfortable erection. A person's sense of self and his sexual relationship may suffer from painful ejaculation. Approximately 2 to 3% of males will ejaculate in agonizing discomfort. Prostate cancer patients may experience pain after ejaculation. People have occasionally reported feeling uncomfortable prior to ejaculation, but it is much more common for patients to have pain after ejaculation. This discomfort can sometimes linger for more than 24 hours. Number 3. Discomfort from sitting due to the patient's enlarged prostate gland. Prolonged sitting can be quite uncomfortable. Prostate and adenocarcinoma is the type of prostate cancer most commonly associated with sitting-related discomfort and numbness in the perineal area. Patients with prostate cancer frequently report these symptoms while seated on a hard surface, severe discomfort during ejaculation. If sitting gives you pain in your lower back or pelvis, you may have prostate cancer. Number 2. Urination issues. For patients suffering from prostate cancer, urine retention in the bladder may make it impossible for them to pee. The main causes of the patient's inability to empty his bladder are the local invasion of the tumor and an enlarged prostate gland. If you discover that you are having trouble urinating, it is highly advised that you consult a urologist very once. Number 1. Loss of bladder control. This is the first possible warning symptom. Loss of bladder control, the term used to describe this issue most frequently, is urine incontinence. Urine incontinence symptoms can differ based on the type of prostate cancer, according to medical professionals. Stress incontinence and urge incontinence are the two main types of incontinence that patients report having. The development of a disease may be indicated by a lack of bladder control. However, the two most prevalent medical interventions for this ailment are radiation therapy and prostatectomy. The prostate plays a part in controlling the flow of urine from the bladder into the urethra. The incapacity of the bladder to contain pee, resulting in dribble and nocturnal bathroom visits following a prostatectomy to stop the spread of prostate cancer. Because there are numerous therapies for prostate cancer, there is a chance that surgery on the prostate would harm the nerves that supply the bladder, which could result in urine incontinence. Now that you are aware of some of the symptoms of prostate cancer, you are at risk. One of the risk factors for prostate cancer is getting older. Prostate cancer is more common after age 50. 25% of men report losing control over their bladders. For unclear causes, black men are more likely than men of other races to get prostate cancer. Prostate cancer in black men is also more likely to be aggressive or to have advanced. Lineage within the family. Your risk may increase if a parent or sibling in your immediate family has been diagnosed with prostate cancer. Furthermore, if you have a strong family history of breast cancer or a family history of the genes BRCA1 or BRCA2, which raise the risk of breast cancer, obesity may raise your risk of prostate cancer. Those who are obese may be more likely to develop prostate cancer than people who maintain a healthy weight. Obese people are more likely to have aggressive cancer and have it return after early therapy, despite contradictory research results. You can lower your risk of prostate cancer by adopting preventive measures, such as eating a diet high in fruits and vegetables. Consume a range of fruits. Choose nutrient-dense foods over pills because fruits, vegetables, and whole grains all include a number of vitamins and components that are good for your health. There is no evidence from studies that supplements lower the risk of prostate cancer. Exercise on most weekdays improves general health, helps with weight maintenance, and increases emotions of happiness. If you're new to fitness, start out cautiously and gradually increase the amount of time you spend exercising each day to at least 3 days a week. If your current weight is under control, maintain a healthy weight by eating a balanced diet and getting regular exercise. If you need to lose weight, up your physical activity level and cut back on calories each day. Consult your physician for assistance in creating a sensible weight loss plan. If you have a very high risk of developing prostate cancer, talk to your doctor about it. Together, you two may look into medications or other therapy to reduce that risk. Numerous investigations reveal that 5-alpha reductase finasteride and dutasteride are examples of inhibitors that may reduce the risk of prostate cancer. These drugs are used to treat hair loss and enlarged prostate glands, but some research indicates that they may also increase the risk of developing a more severe form of prostate cancer. If you use these drugs and are concerned about your risk of developing prostate cancer, speak with your doctor. Adopting a balanced and nutritious diet can play a significant role in managing prostate cancer and promoting overall well-being. Remember to incorporate plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats into your meals. Additionally, consider limiting intake of red and processed meats, as well as refined sugars and unhealthy fats. Consulting with a registered dietitian or healthcare provider can help tailor a diet plan that suits your individual needs and supports your journey towards better health. A variety of symptoms can be displayed by men with prostate cancer. Most males don't exhibit any symptoms at all. For additional information, please watch these videos, like and subscribe, and thank you for watching. If you have any of the symptoms, don't panic or jump to the worst possible conclusions. Just call your doctor. It's important to recognize that prostate cancer is indeed treatable, especially when detected early. With advancements in medical technology and treatment options, individuals diagnosed with prostate cancer have a range of effective therapies available to them, including surgery, radiation therapy, hormone therapy, and chemotherapy, among others. Moreover, ongoing research continues to improve our understanding of the disease and refine treatment approaches, offering hope for even better outcomes in the future. Remember, early detection through regular screenings and maintaining open communication with healthcare providers are key factors in successfully managing prostate cancer. Together, we can continue to raise awareness, support research efforts, and empower individuals to take proactive steps towards their health and well-being.